So good evening, everybody. Good evening, everybody. I have started the recording. So please, if you don't want to be part of this recording, let me know and then you can remove yourself. I will let you know that I have updated the first recording of the podcast that I did. I've updated it today on YouTube. So tomorrow I will send out the link to everyone who is on my broadcast list. If you're not on my broadcast list during the talk, I will send my details so that you can be a part of the broadcast list. Welcome, welcome, welcome. We've got Claudia Slattery, and Claudia has been a personal friend of mine. Claudia, I mean, I'm thinking about 6 years maybe.
Yep, straight after my second little boy was born.
Yeah. So just so that we're all on the same page, Claudia, I firmly believe that health is more than what you eat and drink, whether you exercise or that you avoid certain foods. I firmly believe that health is diverse, dynamic, and deliberate. I firmly believe that health is not possible under the hand of only one practitioner or only one discipline of medicine or healthcare. I firmly believe that health is a person's primary responsibility and must be person-specific. I firmly believe that health must be conversed on a physical, chemical, emotional, mental, spiritual, cultural, racial, and various other undetermined levels. I firmly believe that there must be a better way than what is our current status quo. And Claudia, the one thing that I remember chatting to you about is you sat me down and you kind of showed me the menstrual cycle. And I only knew of the part where the lady gets a little bit irritable and then she's obviously on her period for a week or so. And then she's back to quote unquote normal. And you told me all of this other stuff. And I was like, oh my goodness. And I'd studied to be a chiropractor. We studied all of this stuff and I knew nothing of what you were talking about. So with all of that in place, Claudia, please jump in, tell everybody who you are, where you are, and how you've come to where you are today.
So ladies, gentlemen, I hope we have some men on this. You really want to be here. I am a holistic reproductive health practitioner, a wonderful, wonderful name to essentially mean I love working with women's menstrual cycles because our menstrual cycle tells us everything. And let's just break some myths down from the beginning. We do not all ovulate on day 14. Biggest myth that there was. Okay, what is ovulation? Ovulation is actually the key to our whole menstrual cycle. That period where the blood comes out, that's the end bit. That's the finish thing. That's in so many ways not irrelevant. It's important, but it's the last, it's the byproduct. The key to the cycle is ovulation. When does that egg move out of the ovary and into the fallopian tube? Now, that is so key because whether we are in our teenage years, whether we perimenopausal, whether we menopausal, or whether we want to have babies or don't want to have babies, that is the key to our whole cycle. So how much mucus do you produce? What are you talking mucus? No, not from your nose, from your vagina. Let's put it honest, open and out there, because that is so, so important. When a young girl in her teenage years kind of thinks she has an STD, or worst case, she keeps on going to the doctor because she has a UTI infection, because she wasn't actually taught what this mucus is. It's actually the whole process to the egg in the ovary developing and essentially us being fertile and our body wanting a baby, because that's what we here on earth are here for. So once we learn about this, and when we learn that stress, illness, and traveling affects ovulation. So I'm so sure it's happened to so many of you that you kind of get to day 33 and you're going, am I pregnant? Or where's my period? But you didn't realize that you wrote an exam right before your ovulation and your body said, hold on, I need to keep her alive and make her write the exam. And so your body focused on your health. So when you get onto a plane to New York, I know that's a bit different these days, and you do that before ovulation and you don't sleep and you don't eat and you're fatigued and your body says, oh my gosh, I've got to keep you alive. And you delay the whole ovulation process. So Our menstrual cycle is not the same every single
Claudia,
cycle.
what you're saying to me is that a lady who thinks that they have the standard cycle that happens here, it goes to there in 21, 28 days or 6 days. What you're saying to me, that's not how it works. It shifts and changes every month based on so many different circumstances. So what you're saying is it can be very diagnostic of where a lady is in her day-to-day life.
Exactly. So someone can have a normal 30-day cycle and then go down to 21 days. But so often we don't have the answer there and then, and we all want it now. But in 3 months' time, suddenly we start getting a pattern, or we start getting our answers answered. And a woman who's coming off hormonal contraception can take 6 months to a year to actually stabilize her whole cycles before it actually becomes.
So let me ask perhaps a difficult question to answer. How many ladies have a well-functioning cycle in your estimation versus how many ladies have a not so well-functioning cycle?
Okay, so what do we mean by a well-functioning cycle? Is it just a number of days? No. When we look at a well-functioning cycle, we look at different aspects. We look at how much are you bleeding? The quality of the blood, is it nice red? Is it clots, no clots? Then we look at the pre-ovulatory phase, the phase before ovulation. How many days is it? We then look at the mucus production. How many days is it? What kind of quality is it? And then we look at from ovulation to the next cycle. That's always standard. Your period is never a surprise. If you know how to chart your menstrual cycle using an effective method of charting.
Hang on a second. So I'm a well-educated husband. I know that my wife knows, when her last cycle ends and when her next cycle should begin roughly. So when you say charting a cycle, I mean, that's not just putting a tick in your calendar saying, okay, this is day 1, and then a tick here, this is day 28. Charting a cycle, obviously, for you means a lot more.
That's it. So you can do it on a specific app. Please don't go and just buy any app. I promise you there are about 1,001 apps out there. It's about learning how to identify mucus. I teach the Justisse Method of fertility awareness, a 99.6% effectiveness rate, whether birth control, whether conceiving, wherever you are. But what it does is it teaches you about your body, teaches you how to identify mucus. It teaches you to identify if you are infertile, otherwise I can't have a baby, or I'm fertile, I can have a baby. And it teaches you what is healthy. So going back to that previous question of yours, health is no pain when you are bleeding. Discomfort, because come on, the lining of the uterus is coming out of you. Okay, so you might not feel like you want to go and run Comrades Marathon that day. Fair point there, but not pain. If you are having to take a Panado, a Nurofen, any sort of ibuprofen for the pain, that is not normal. Okay. You should not have PMS, bloatedness, moodiness, sweet cravings, anything like that. Depression, by the way, another very big important part is because of the way the menstrual cycle works. We go roughly 3 weeks. We're using the estrogen in our body, which is the go-go hormone. We feel on top of the world. And after ovulation, so many women come down, they get dropped by the progesterone. But what happens is so many women get misdiagnosed for depression because when they have post-ovulatory phase, which is about 2 weeks, it gets so low for 2 weeks. And you'll probably find that that's where you're kind of needing the antidepressants, or you're booking the phone call with the psychiatrist. Then you have your period, and then you kind of start feeling okay. And it's like, cool, yeah, this is good. And then just as you start feeling okay again, guess what happens again? Post-ovulation. So you're back in the depression. So many women are being misdiagnosed with depression as opposed to PMS. So there's so many factors when we talk about a healthy cycle. If your cycle is healthy, every other aspect of your body is healthy. And that's
Okay,
profound.
so listen, pause. I just want some clarity, okay? How many healthy cycles do you get to see versus how many unhealthy cycles that you get to see? I'll put it in my perspective. As a chiropractor, I'm interested in spinal stability. So if you've got good spinal stability, you've got a healthy spine. I've been in practice for 17 years. I've only seen 5 people with good spinal stability. So that's my answer about the spine. How many people do you see with a healthy cycle versus how many you see with an unhealthy cycle?
I would say closer to the women who come to me are the ones who have not used hormonal contraception, and the ones who listen to me and that were at the beginning, okay? And starting with a healthy cycle, you're looking at about, in my lifetime of 8 years of practice, probably about 10 to 20.
That is scary. So you were just about to go to how the cycle affects the entire system. But before we do this, I think there's going to be people on this call, whether it's moms or dads or perhaps young ladies. How early should people be learning about their cycle? Should that happen? Okay, you've had your first period. Let's have a chat about it. Or should it be something that has dealt proactively long before that? I mean, you've got a daughter, Claudia. So if you don't mind, tell everyone how old your daughter is and when would you start teaching her about cycles?
My daughter's nearly 7, and I reckon she's going to start learning. She learns to, let's put it in perspective, she learns to count on organic tampon boxes. But she is probably around 10 is where I will actually start it, because she's already said, oh, when do I get breasts? And she's already asking those questions. And in my family, we talk as it is. We talk of it, we say, this is the vagina, this is the penis, because I want her to love her perfect body. I want her to respect her perfect body. Because when we as women realize that this body that we have been given is so perfect, why do we want to use a method, whatever it is, to prevent pregnancy that is going to affect every single system of our body? Because when we use hormonal contraception, it doesn't just stop that ovulation. If ovulation is a focus point of the whole body, shouldn't we be teaching our young kids that is important? Not that you're going to get this bleed so-and-so every month, here's a pad, there we go, done. But rather start teaching them, yeah, you're going to get this mucus. This is what this mucus looks like. So that when a child gets it, she's not going to be scared. She's not going to be going, oh my gosh, what is this? But she's going to rather come and be educated. So from my point of view, this should be taught anywhere from the age of 10, 11 years old.
Exactly.
And every single woman that comes to me says, why was I not taught this at 12 years old?
Wow. And Claudia, when you say that it affects the whole body, will you dive into that? How does it affect the whole body? I mean, I know in my office that hormonal influences is a massive influence on a person's overall health. But how do you describe that?
Okay. If the ovarian axis, in other words, we women are here for one purpose. Let's be honest. It's to reproduce. Okay. Our purpose here is to reproduce. From the age of about 12 years old, we could. Not that we want to, but we could. Now, that system affects our endocrine system. It affects our fight and flight, our nervous. It affects every single system. So you stop that by stopping your period because my child has acne. That's a good reason. It's something that we come across so often. I put my child on hormonal contraception because she had acne. Now you're stopping every other system from functioning and wondering why in 6 months' time her mood's changed and now she's got depression, or why it's affecting her growth, or why it's affecting her energy in her sports. It has a profound impact, because if you affect one thing, the body's not one, it doesn't work just as independent. Yes, we might have a an eye doctor and a dentist and a physio, but the body works together, and chiro is exactly that. You go, and I've seen with my patients who've gone to Travis that I've said and I've referred, I say, okay, you need to go to Travis for this. Guess what happens? Their blood clots change as well. And I have seen that, so the whole body works together. And if you try and section it, it doesn't work.
Yeah, I mean, certainly, Claudia, from the chiropractic point, and I don't want to harp too much on it, but since you mentioned it, I have certainly seen from the neurological perspective, and you mentioned stress, that, you know, a person who is in that stress overload, they're in that threat nervous system. I mean, their cycle goes all over the place, and chiropractic is great at getting someone to regulate to a more balanced nervous system. And I've seen cycles change left, right, and center. Obviously, I don't know too much about them, but I know that they change because the lady, you know, sort of feels that. But I want to dig in. I mean, you've mentioned contraceptives. Would you say that there is a reason, in your opinion, would you say that there's a reason for someone to be on contraceptives, whether they are chemical contraceptives, IUDs, what would you call them, sort of condoms, male, female condoms? Would you say that there is a need for contraceptives in any way?
Okay, we are all individuals. We all have individual relationships. And that's what we have to really be aware of. Our circumstances are also different. If you are a woman who has the ability to be in a good, healthy relationship, and you want and this is for the men as well, an increased libido, and you want a sex life and a relationship with your husband, hormonal contraception actually decreases your libido. So there is a place for contraception. However, always know there's a pro and there's a con to every single method you choose. So you need to decide what are the pros and what are the cons. However, how do you get this information? If you go to a practitioner, so often they are only going to give you one biased option. So you need to do your research. So if you're thinking of a Mirena, well, let me go and Google and look at all the pros or all the cons. Or sit with somebody who's going to say, okay, these are your options. This is the pro, this is the con. Do you want to have a blood clot, or do you want to have a potential baby? And I'm sitting here saying there are risks. And what I mean by that is when I was around 24 years old, I was faced with all the women in my life who were around 40. And so many of them had had breast cancer. And I started to question that. I started to look at all these 40-year-olds and go, why does she have breast cancer? Why does she have breast cancer? And that's when I thought, no, there's something to this. And I really respect, there's an amazing practitioner in Joburg, and she said to me, she was part of my running group, she said, Claudia, hormonal contraception caused my cancer, and it was one big part of my cancer. And she was 35 at the time. Now, I'm older than 35. So that freaked me out when I heard about that close to 10 years ago. So when it comes to hormonal contraception, there isn't one answer. And we've got to sit there and look at that couple, look at that individual. Is it an answer just for my acne? Is it an answer because I've got period pain? No, because you've got to dive down and ask, why do you have the period pain? You've got to go and ask, why do you have the acne? All the hormonal contraception, any contraception that's out there is just going to mask it. And guess what? 10 years down the line, when your child wants to have a baby, she's going to have a problem. Because what hormonal contraception does is it actually pauses the reproductive system. So if you go on it at about 17 years old, your reproductive system is 17 years old. Say you come off it at about 28, 29, you might be 28, 29 wanting a baby, but your reproductive system is still 17 years old. And now we've got to actually get it to start operating again.
Sure. Someone's asked a question. I think it's valuable to come back to. She said, how much of the PMS symptoms are a mental game, or is it all physical?
A lot of it is physical, and a lot of it. So what my clients do when they come to me and they start charting, I go, give me all your PMS symptoms. I want to know what you're experiencing the first cycle that you see me. When they listen to my advice, that list cuts into close to a quarter by the third cycle. And I have had so many women who go, oh my gosh, it was all related to my diet, my lifestyle, and potentially any hormonal contraception that I was on. That person feels so different because they have taken responsibility of their own health.
So what you're saying, Claudia, is you can regulate a significant amount of cycle dysfunctions with healthy mechanisms.
Completely. And then you don't need the pill to stop the acne. Then you don't need the pill to prevent the moodiness. You don't need that device to stop the heavy, heavy bleeding. Because the power is in your hands to want to make the change. You always have a cycle that fluctuates slightly. You're always going to have that because ovulation might happen day 13 or day 15. Or in some cases, I've got clients who have it only happens at day 20 or day 28. But the key is that through your menstrual cycle, you can see your health of your body, and it's so empowering. When you sit there and you're putting it on pen and paper, and you're actually seeing the internal workings of your body come to life on paper, it gives you that ability to say, oh, do I want to make that change? Is it worth it? Is it not? And that is what makes my job so phenomenally worth it.
So just
when women say,
give some specifics, Claudia, of what things that, if people are on the call now that have potentially got cycle challenges, what would you say top 3, top 5 things that they can do right now? Let's be as specific as we can to influence their cycle. Obviously, you're saying number 1, they've got to monitor their cycle, not just when they come on and when they go off, and perhaps when ovulation is. They've got to monitor everything, which I think is a whole conversation on its own. Let's not go to that, because obviously people can contact you afterwards. But if a person is monitoring their cycle, what would you say the top 3 to 5 things are that a person can do right now that can start to influence their cycle positively?
Okay. Firstly, eat proper food. That's a big thing. Food that comes from the earth. Vegetables, potatoes, meat, eggs. Eat food that is real, number 1. Number 2, I always like to say to people, move on to water that is not from the tap, especially in Joburg. I have had incredible experiences where women who drink tap water have had very estrogen dominant cycles, and had cycles that are very much affected by their hormones because they're drinking the tap water in Joburg. So I always get them to drink filtered proper water. And once you get off that tap water, you notice that within a week. And the next thing is to try and remove as many chemicals in your life. Because we don't realize how much exposure, whether you're touching the surface on your counter, the clothes that you're wearing, what you're washing your clothes with, where you're sleeping at night between your sheets, the chemicals we're washing. Our body is completely and always touching something. And those 3 things are big things that we have control over, which is quite profound.
But I mean, getting rid of chemicals, I mean, this is a massive conversation.
And it's also one that really affects our whole body. And once we do those, once we start, and I always like to work with somebody slowly. Because if I come to you and I say, let's change your whole life straight away, oh my gosh, no, not a chance. But it's that conversation of, okay, so you've made that change. How do you feel? Oh, okay. You've made that change. How do you feel? Because once you start feeling different, it's so easy to make the change. So working with people isn't just a come see me once off, because that is not going to make a profound impact. Because what it is constantly looking, how can I feel better? What do I need to do? Am I going to relinquish all my power to somebody else and say, fix me? Or am I going to actually hold it in and say, great, let me take one step. What do I need to do? Have I got heavy menstrual bleeding? What do I need in order to do that?
Let's move to the other reason why people go on contraceptives, and that is for contraceptive reasons. But I know a lot of your conversation is how to, if you don't want to fall pregnant, how to be able to do that cleanly. And if you do want to fall pregnant, how to do that, as effectively as possible. I mean, I know in this day and age, there are many people that are going on IVF and all sorts of additional things to try and fall pregnant. What's your conversation towards that, Claudia?
Okay. When you chart your cycle, and can I just say something, that what I work with is not the rhythm method. The rhythm method is definitely not an effective method of birth control. So please, if anyone thinks I'm talking about the rhythm method, it's not that. Our body is so profound that you either can fall pregnant or you can't. If you're not falling pregnant, your body is not healthy enough. Your body's trying to keep you alive. It can't make a baby. If you are looking for a contraception perspective, again, this method is effective. You have specific rules. If you don't follow the rules, you will have a baby if you are healthy. So when it comes to contraception, there are natural options and natural ways to do it without hormonal contraceptions. But know that whether you're wanting to fall pregnant or not wanting to fall pregnant, and you're in this fertile phase, okay, you have options to prevent pregnancy or to conceive the natural way, which is going to take time to learn, which is going to take time to actually do. But I can tell you that every single one of my clients who have come to me and followed and worked with me, who has battled to conceive, has had a baby in the end without IVF. That's quite profound for me.
Sure. I can imagine for a lot of people that's very hopeful.
And that's because the people who have listened have healed their bodies. The people who've come to me from birth control have got a very effective method of birth control. They are happy in their relationships. They are healthy in their relationships. They're having lots of sex. And they have a diagnostic tool that they know if something goes wrong in their life, their menstrual cycle is going to pick it up. And you know what? They're not going to know what to do with it, because I teach them what to do when your cycle goes crazy.
I mean, if I was a girl, I'd want to know how to monitor my cycles so that I'd know what was in my body and what is affecting it positively or negatively. Someone has asked a question about drinking coffee, and I think that's valuable. Just to let you know, Claudia, we've got 10 minutes left, and we've still got our 2 big questions to get to. But also before that, remember, we need to chat a little bit about perimenopause and menopause. So if you don't mind, get to the perimenopause and the menopause now, and then we can see where we get to in the next 10 minutes.
Yeah. Perimenopause is such a wonderful phase because it's the phase that if anybody needs to chart their cycle, it's a perimenopausal woman, because she never knows when her cycle's coming. Because what so often happens is a perimenopausal woman will start with shorter phases, shorter cycles, around 21 days, and then it will go longer and longer and longer to 60, 90, 100 days until you haven't had a period for a year. Perimenopausal women it is so important to look after your body. In those phases, if you've had children, you've also got probably middle-aged kids, kind of teens as well, or even younger kids. Now, how on earth are you going to keep up with your kids if you are not functioning? And this is what is so important. is you as a person, as a woman, as a mother, as a businesswoman, has to function optimally. If you are phoning in every month to say, sorry, I've got period pains, I can't come to work, that's going to affect you. It's going to affect your performance in every area of your body. So perimenopausal phase is about looking after your body. Because if you look after your body, then you can give out to anybody who you need to, whether it's your children, whether it's your boss, doesn't matter. But if you don't focus on your health in that phase, your menopause is going to be very, very rocky.
Certainly, what is a common conversation is ladies who go into perimenopause and menopause have a lot of the negative symptomatology that goes with that, and it's almost something that they're scared of, and something that they're needing a lot of additional outside help to facilitate that process. Is that necessarily in your estimation?
If we start looking after our bodies as women, we won't need that, and you'll see how different you function. It's about having the right team. And I always talk about my team of women. I am not the woman I am without my team. And I talk about my midwife, my doula, my chiro, my craniosacral therapist, my massager. It's the team. Because at different times in our life, we need different things to actually just make sure we are on top of it. If we work with that team and we maintain our health, so when you're working too hard, you know who to go to. When you are too stressed, we've come through a huge phase of fear, of stress, emotional, physical stress that we're experiencing. All of that eventually affects the body. And therefore, we need to have a team of women or a team of practitioners who are not your medical people, but who they're just to be there to support you. And I know the way Travis works a lot as well is that supporting. Just come every now and then, and you know what? You don't get sick. If you look after your body, you don't go into chronic phase. But chronic phase only goes when you've neglected yourself and you've lived that life of convenience. And menopause. Remember, menopause is broken up into pause. It's time to pause. It's reflect. Look at the men, women, men in your life over the last 30, 40 years. How have you treated yourself? Are you going to pause and stop? Or are you going to carry on trying to run and not actually take that time to focus on yourself?
Sure. I mean, I think for a lot of people, this is a big change in how they're looking at their life right now, and how they projecting that forward over the next 10, 15, 20 years. You know, my wife and I are sort of early 40s, and that means that we should be looking at where we're going to be in the next 10, 15, 20 years, and what we should be doing differently. Because if you're saying menopause means you got to pause, it means you got to have some availability to look at life differently.
Yeah. Now I'm going to use this. I've got a lady who is middle 50s. I taught her quite a few years ago, and now I taught her daughter who got married last year. Her mother still comes to me for a birth control method because she still has the ability to fall pregnant. In her middle 50s, she's not menopausal. She's perimenopausal, and we've seen some changes, but she is so healthy in her middle to late 50s that she's like, Claudia, I cannot fall pregnant. I have a daughter who's now 27 and is using the method for birth control. So that's so important. You know, I get so frustrated as, oh, you're 35, you're too old. And I'm like, no.
Claudia, I'm going to cut you off because we've got 4 minutes left, but I'm going to cut you off. But I think for a lot of people that it's quite easy to say, oh, they're moving into menopause. But meanwhile, it's a dysfunctional cycle. It's not menopause.
That's it. And menopause is like puberty. You don't remember one day having no boobs and the next day having boobs. It's a 10, 15-year cycle. And you need
I've never had
watch
boobs,
that
so I can't agree with you. But let's go. What would you
Okay.
like the future of healthcare to look like? What would you like the future of healthcare to look like? And how do we, the collective we, move in that direction?
Okay, I'm going to answer that. The coffee question, yes, it does. Too much of anything affects your cycle. Everything in moderation is a very, very key point. So I'm going to highlight that quickly, okay? Because somebody who asks me that generally drinks too much coffee. Okay, so that is one question. There, 1 cup of coffee I'm okay with. There are other people who say absolutely none. Okay, future of health, people taking responsibility. I want people to shop around for practitioners. So many people go to one doctor and that is it. You find that person and you find that team of people who talking the same language, where you realize that so much of our health is our responsibility. And if you want to feel healthy, if you want your children to be healthy, and if you want to be that 60-year-old that's still mobile, still flexible, still has a quality of life, the responsibility is in you, not in the pharmaceutical industry.
I think that is just phenomenal, Claudia. And that's certainly the purpose of this podcast, is to get people to be empowered to take care of themselves. Is it difficult to start monitoring and taking note of a woman's cycle?
No, it can be as simple as, hey, I'm taking note of when my period is, and then when the next one comes. It becomes taking aware of what you're seeing, what you're feeling. And we all have our own story, and we all take our own time. But when you are ready to learn about it. And if you are, I'm here. But it's so easy to just become conscious. And that's the first step to anything, becoming aware.
Yeah, I mean, I see a lot of this conversation about awareness, and I think it is vitally important. The whole analogy, we're so busy that we don't stop to even have a look at our bowel motions. So, what you're saying is there is another thing for ladies to be able to take note of and recognize and to be able to, make a decision from there. It's empowering people to know exactly what they need to do. Claudia, we've got 1 minute left. Here you go. You got anything else that you need to say? Say it now. And for everyone on the call, thank you so much for your time. God bless you. And I really appreciate you for joining. Claudia, last minute. Let's go. What do you got to say?
Pretty much. Years ago, I went to a gynae. I told her everything about my cycle. She looked at me and said, why are you here? I've never had somebody come and tell me all of that. And that was such an amazing moment when the gynae said, why are you here?
Claudia, thank you very much, my girl. Have a wonderful evening. Everybody, God bless you, and look after yourself.
Thanks, Travis. Have a good evening.
Pleasure.